Welcome to today's discussion on bladder metastases. We'll explore what happens when cancer spreads to the bladder, covering causes, symptoms, diagnosis, treatment, and more. This comprehensive overview aims to provide a clear understanding of this complex condition. Bladder metastases occur when cancer cells from a primary tumor elsewhere in the body travel through the bloodstream or lymphatic system and establish themselves in the bladder. Common primary cancers that metastasize to the bladder include melanoma, lung cancer, breast cancer, colorectal cancer, and cancers of the female reproductive system such as ovarian or uterine cancer. Rarely, it can be from prostate cancer. The likelihood of metastasis depends on factors such as the type and stage of the primary cancer, its aggressiveness, and the individual's overall health. Sometimes, the spread can occur by direct invasion from nearby organs, but this is less frequent than blood-borne or lymphatic spread. The pathophysiology of bladder metastases begins with the detachment of cancer cells from the primary tumor. These cells then enter the circulatory or lymphatic systems, allowing them to travel throughout the body. Once these cells reach the bladder, they adhere to the bladder wall, often facilitated by specific cell adhesion molecules. The metastatic cancer cells then proliferate and invade the bladder tissue, disrupting normal bladder function. This invasion can lead to the formation of secondary tumors within the bladder. The tumors can then disrupt the lining of the bladder, cause bleeding, or obstruct urine flow. The body's immune system may attempt to fight off the metastatic cells, but this response is often insufficient to eliminate the established tumors. Bladder metastases are relatively rare, representing only a small percentage of all bladder tumors. The exact incidence and prevalence are difficult to determine as they are often not specifically tracked separately from primary bladder cancers. However, it's understood that individuals with a history of the primary cancers we discussed are at a higher risk. Age also plays a role, as the risk of both primary cancers and metastases increases with age. Furthermore, some studies suggest a slight male predominance in bladder metastases, possibly reflecting higher incidence rates of certain primary cancers in men. The signs and symptoms of bladder metastases can be varied and often mimic those of primary bladder cancer or other urinary tract conditions. Common symptoms include hematuria, or blood in the urine, which is often the most noticeable sign. Patients may also experience frequent urination, urgency, and dysuria or painful urination. Some individuals may have lower abdominal or pelvic pain. If the metastases obstruct the flow of urine, it can lead to urinary retention or kidney problems. In some cases, bladder metastases may be asymptomatic and discovered incidentally during imaging studies for other conditions. It's crucial to note that these symptoms are not exclusive to bladder metastases and require thorough investigation to determine the underlying cause. Diagnosis of bladder metastases involves a combination of clinical evaluation, imaging studies, and tissue biopsy. The process typically begins with a detailed medical history and physical examination. Urine analysis is performed to check for blood or cancer cells. Imaging studies, such as cystoscopy, which involves inserting a thin tube with a camera into the bladder, are crucial for visualizing any abnormal growths. CT scans and MRI scans can help determine the extent of the disease and identify potential primary tumor locations. A biopsy, usually performed during cystoscopy, is essential to confirm the presence of metastatic cancer cells and determine their origin. Immunohistochemical staining of the biopsy sample helps identify specific markers associated with different types of cancer, allowing pathologists to trace the cancer back to its primary source. This detailed analysis is crucial for accurate diagnosis and treatment planning. While there isn't a formal classification system specifically for bladder metastases, they are generally characterized based on the type of primary cancer and the extent of the spread. The term synchronous is used when bladder metastases are diagnosed at the same time as the primary cancer, while metachronous indicates that the bladder metastases are detected after the primary cancer has been treated. The number and size of the metastatic tumors, as well as the involvement of surrounding tissues, are also important factors. It's essential to identify the primary cancer to guide the treatment approach, as different cancers respond differently to various therapies. Treatment and management of bladder metastases are complex and individualized, often involving a multidisciplinary team of oncologists, urologists, and other specialists. The primary goal is to control the spread of cancer, alleviate symptoms, and improve the patient's quality of life. Systemic therapies, such as chemotherapy, targeted therapy, or immunotherapy, are often used to treat the primary cancer and any metastases throughout the body. Local therapies, like transurethral resection of bladder tumor, or TURBT, can be used to remove tumors within the bladder and alleviate symptoms such as bleeding or obstruction. In some cases, radiation therapy may be used to target specific areas of the bladder. Surgical removal of the bladder, known as cystectomy, may be considered in selected cases. Palliative care plays a crucial role in managing symptoms and providing supportive care to patients and their families. Preventing bladder metastases directly is challenging, as it relies on preventing or effectively treating the primary cancers that can spread to the bladder. However, adopting healthy lifestyle choices, such as avoiding tobacco use, maintaining a healthy weight, and following recommended cancer screening guidelines, can help reduce the risk of developing primary cancers. Early detection and treatment of primary cancers are crucial for preventing the development of metastases. Regular follow-up appointments with healthcare providers are essential for individuals with a history of cancer to monitor for any signs of recurrence or spread. The prognosis for bladder metastases varies significantly depending on several factors, including the type and stage of the primary cancer, the extent of the metastases, the patient's overall health, and the response to treatment. Generally, the prognosis is guarded, as bladder metastases indicate advanced disease. However, advancements in cancer treatments have improved outcomes for some patients. Recent research has focused on developing more effective targeted therapies and immunotherapies to treat metastatic cancers. Clinical trials are ongoing to evaluate new treatment approaches and improve survival rates. Furthermore, research into the molecular mechanisms that drive metastasis is helping to identify new targets for therapy and develop strategies to prevent cancer from spreading. Continued research and innovation are essential for improving the prognosis and quality of life for individuals with bladder metastases.